This is Vicki. I'm in nursing 215, and I'm going to discharge my patient today and discuss his medications. Still have to alcohol in. Hello, Mr. JD. My name is Vicki, and I'm going to go over your discharge papers with you today, with you and your wife. Hello, how are you? Can I have your name and birthday, please? Thank you. So, you're going to be going home today, and I just kind of want to go over the medications that your doctor prescribed for you, which are going to be new for you. Also, I see that you take Protonix and Synthroid at home. So with the Protonix, you take that for your acid reflux. What it does is it just your body makes all of this acid, and that acid goes up into your throat, and that's where you get the heartburn and the nasty taste in your mouth and all of that. So what the Protonix does is it holds down that acid so that it gives your throat and your esophagus time to heal. Now, there are some side effects to that. You can have headaches, you can have nausea, you can have vomiting, you could have extra gas, and joint pain. Now, those are side effects that generally go away. In case you didn't know, they do generally go away. But now, if you start seeing where you don't urinate as much, having watery stools, fever, a stomach ache that won't go away, then I need you to notify your doctor. And also, what's very important is that you don't stop that medication. Just stop it, abruptly. You have to continue to take it until your doctor takes you off of that. Any questions for me? Okay. I also see that you're on Synthroid, and that's for your hypothyroidism. So what that does is where your body is not making enough hormones to help. How can I put it? Your body is not making enough hormones throughout your body. That's what causes the fatigue, and so with that, the Synthroid, it acts as a replacement of those hormones that your body is not producing, and so that kind of helps with your tiredness and your fatigue, helps with your body temperature, kind of like regulate everything for your body. Now, the side effects for that are palpitations. Palpitations are fast heartbeats. You can have those palpitations, you can feel anxious, have problems sleeping. Those will eventually go away as well. But if you have those palpitations or the fast heartbeat and you have it with chest pain, you need to notify your doctor so that he can adjust it. Or if you get so fatigued you can't do anything, then that's going to be a call to your doctor as well. Okay? So your new medications I see is he put you on Lopressor or metoprolol. He put you on Zestril, which is also called lisinopril, and he put you on metformin. So the Lopressor or the metoprolol, that's for your heart rate and your blood pressure. What it does is it helps your heart work less to pump that blood throughout your body. So with the metoprolol, you have to watch your heart rate as well. So you'll need to be monitoring your blood pressure. If you see that your heart rate is 59 and below, then you don't take that metoprolol, because it not only lowers your blood pressure, it's going to lower your heart rate as well. And we want your heart rate at 60 and above. Okay? Any questions on that? So with the side effects for that, you can have shortness of breath, you can get some swelling, some dizziness. With that, you have to make sure that when you get out of bed in the morning, afternoon, after a nap, whatever, when you get out of the bed, you sit on the side of the bed and you kind of get your balance right, because it is gonna make you dizzy. When you get out of chairs, get up slowly, just kind of move slowly. When you even turn in the bed, turn slowly, because it will cause some dizziness. Now, if you get your lips swell, your face swells, anything like that, even if you feel your throat swelling, that's going to be a 911 call. So you're going to have to go to the emergency room and then let your provider know that you had that effect to that medication. Any questions on that? You, Miss JD? No? Okay. So he also put you on lisinopril, which they also call Zestril, and that is also for blood pressure. That's to control your blood pressure. So what it does is it opens up the vessels where the blood flows. When you have high blood pressure, those vessels are really, really tight. So what it does is it opens up those blood vessels where the blood can flow through, and your heart does not have to work as hard to pump that blood throughout your body, and it lowers your blood pressure. With that, you can also have some dizziness, you can have a headache, and you may get a dry cough. One of the side effects is a dry cough. Some people say they have it more at night. Some people have it throughout the day, but you will get that dry cough. Now, if the same as with the what was your other medication? Oh, no. So with the lisinopril, if you have swelling, you're just so fatigued, you can't do anything, your face swells, anything like that, make sure you call your doctor on that, call your provider as well with that. Okay. Also, you have a new diagnosis of diabetes, and I know that the diabetes nurse came in and discussed that with you. I'm going to discuss the metformin. So the metformin is to help you help your body regulate your blood sugar. So what it does is it stops your liver from producing so much sugar to where it gets real high. And then it also will hold down the sugar that you eat from foods, different foods. Some side effects of that are upset stomach, diarrhea, nausea, when you start the medications. But that will eventually evolve to resolve itself as well. But if you have difficulty breathing, unusual fatigue, just like with the lisinopril and the other medication, you're just so fatigued you can't do anything, then I need you to call your provider, your doctor, on that. I see that's all the medications that you have. Any questions for me? No? Miss JD? No? Okay. All right, well, thank you for allowing us to take care of you during your hospital stay. And someone will be coming in and helping you get dressed and helping you actually get discharged out of the hospital. Thank you.